Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Caliber, Dr. Jason Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that.
Hi, Dr. Jace.
Hi, Dr. Gav. How are you?
I'm very well, thank you. And we are the Penis Doctors. This is the Penis Show. It's great to be here again. I feel like it's been a while. How's everything going over in Western Australia?
Yeah, no, it's all good here, and it's good that you guys are continuing on well over there in Sydney.
Yes.
And we've got something new to discuss today.
That's right, and I'm very curious about this. It is a lot more about what you're doing in your clinic, but I would love to hear more about it, which is the scrotoplasty, I believe.
Yeah, so it goes by a number of names. Scrotoplasty is one of the surgical terms, or ventral phalloplasty, if you want to get really technical. So ventral is the underside of the penis, and phalloplasty, it just refers to reconstructing the penis. But basically it's the surgical treatment of penis scrotal webbing. So when the skin of the scrotum is sort of attached further along the underside of the penis, sometimes all the way up to the head, and sometimes guys will call it the turkey neck.
Yeah. Oh, look, I have certainly seen this many times, and it often almost can give the impression that the penis is shorter as a result.
Yeah, so there's three main concerns really that guys have with it. Yeah, and because the scrotum almost hangs from the end of the penis near the head, yeah, it can look short, and nobody likes that appearance of looking shorter, as we covered in one of our earlier podcasts. So there's that. There can be discomfort during sex. So in penetration, that skin is getting caught up, and then just the general look of it.
Right. Okay. And so something can actually be done about this from a surgical. It's a surgical procedure that you offer.
Yes. So really the only treatment is to surgically excise some of that skin. And basically the way to work out how much skin is going to be removed is to sort of grab the penis and stretch it straight out, perpendicular sort of from the body, and then grab the scrotum and pull it straight down towards the feet. And you get this sort of triangular web between the two. And it's really just excising a V as you look at it from the side, or when you lay it out, it becomes a diamond, a V of skin. And it's really just the surface skin and what we call the dartos muscle that's intimately woven in with the skin. Just cutting a layer of that out, that diamond shape, and then stitching it back together.
Okay, so are you removing any of the excess skin, or are you literally just cutting and then restitching?
No, yeah, you cut a big diamond of skin out.
Right.
And then the number one thing for the surgeon to be aware of is to not cut too much skin out, because the penis is flaccid, and certainly when you come to start cutting out a piece of skin from a guy's scrotum, it certainly goes as flaccid as it's going to go. So the blood flow drains out, and that then is shrinking the girth. And so we need to remember that they need that extra skin for when they've got an erection. So you need to make sure that that we allow enough skin. And in fact, the general sort of way is we just place your index finger, middle finger, and pinch the skin along that undersurface of the penis, and that gives you a fairly standardized amount of excess skin that the penis can expand into with an erection.
Right.
That gives you the line, and then sort of similarly along the top of the scrotum. So you've got enough room down there. It's less of a concern on the scrotal sort of side. We don't have to worry about that expanding in the way that the penis does.
Right.
But yeah, the things that guys really like is that appearance of extra length, and it can make quite a difference. Not that people tend to measure the length of their penis from the underside. I think most people measure it from the top.
Sure.
But certainly as the appearance of length, it makes quite a difference.
Okay. And I guess the main question guys would be wondering who have this problem is, what's the risk of the procedure? What's the downside? Any, thing they should be worried about getting this procedure?
Yeah. So, well, as I said, the number one risk is taking too much skin. So it's better to leave a bit extra than to take some. We need to have a little bit of finesse with how it's sort of done. So at each end, you don't end up with what surgically we call a dog ear, with a point of skin that sticks up. But again, it's better to have a little bit of extra skin there than not. But usually it can be tapered in such a way that it blends in nicely. So cosmetically, we want to have a nice result.
Sure.
Want to make sure that we've left that sufficient skin for expansion with erection. But actually, there's not a huge amount of issue. Otherwise, it tends to heal up quite well. There's a natural midline join there. Most guys can sort of see that line that goes down the middle of the scrotum. So the scar blends in really well because there's muscle embedded in the skin. It's got a really good blood supply.
Right.
And it tends not to heal with a really pale scar like we might get elsewhere on the body. Having that muscle in the skin tends to keep it well colored. So it blends in really well. And so it heals up quite well. It can take a little bit of time before you can be back into full normal activities, at least 3 weeks perhaps before you can have sex.
Sure.
Often we'll use dissolving stitches and just let them dissolve away by themselves. That way you don't even have to have stitches removed.
Mm-hmm. And is this something that guys are having done in sort of a day surgery procedure and they're awake just under local anesthetic?
Yeah. So as you know, over here in Perth, we've got a registered day hospital for twilight sedation. Actually, so we will give them some sedation. So guys tend to be able to fall asleep during the procedure. Mm-hmm. It is possible just to do it purely under local anesthetic. Guys are obviously a bit nervous about this sort of thing and worry that this is going to be super sensitive. As far as it's not that sensitive an area to be operating on. And in fact, sometimes it's better for a guy to be just awake for this kind of procedure because then we don't have to worry about them being sort of half zonked out and moving or anything. But no, it's something that is easily done. And then, a bit of a dressing on it, some tape on there, and they go home the same day.
Okay. And so the first week, they're going to be taking it easy, no intense exercise.
Absolutely. Yeah. You have to keep off the mountain bike for a while. That's not a good idea.
Yeah.
And then I guess the other thing, for us with caliber and penis girth augmentation with injections, the webbing can be an issue because you've got all this extra skin that the product can go into. I have done caliber on guys with moderate degrees of webbing and not had a problem. But occasionally I've had guys when you're really trying to get the base of the augmentation to blend right down towards the scrotum and you get just a little bleb of the product that's sort of leaked, maybe it's a centimeter too far and you've got like this little ball of product sort of almost a fraction separate from the actual penis itself. And that's the sort of thing that I guess I worry about. And, there have been guys who, in earlier times, I've said, look, we're not going to do caliber and do an augmentation until you've had the webbing corrected.
Sure. Yeah, and I've encountered the same issue with a few guys, and it tends to be that we can't fill. We want to fill a nice cylinder all the way back, the same on the top, the same on the bottom. But with the webbing, it sort of becomes quite top heavy because you can fill the dorsal surface of the penis really nicely, but then we're restricted in how much we can fill the underside. So it can look a little bit asymmetrical from top to bottom. So I guess it's these kind of guys who might consider this scrotoplasty surgery beforehand. How about if someone is out there who's had the caliber procedure already, and they're thinking, well, am I still able to have this procedure done? Is it going to affect the filler in any way, or what's the outcome there?
Yeah, no, so it shouldn't affect the filler in any way. You're really just wanting to take a thin layer of skin. We're not wanting to try and take anything more. So that's not a problem. It's also good that it's got a bit of extra girth there already, but you still need to allow that extra skin. Sure. So I guess the problem for your guys over in Sydney is that I'm in Perth, and so long as our borders aren't closed, you could fly over to Perth and have the surgery over here.
Exactly. Until we find someone, either myself or someone else, willing to do the procedure here in Sydney, and we'll keep you updated on that for sure. That actually does lead me to another question, which is not entirely related to the scrotoplasty. I have a lot of guys asking, obviously we've done the episode on the ideal penis for the caliber procedure. And the ideal penis being circumcised. Now, I have a lot of guys who have the procedure who are uncircumcised. They're quite happy, but then they think, you know what, if I've gone ahead and done the procedure and I'm really liking it, maybe I'll get a circumcision to make it even better. But they obviously, the question they ask is it a problem getting the circumcision when I've got the filler already in the penis?
Yeah, really interesting question. I don't do circumcisions myself. And so, yeah, I'm not certain how it would affect having a circumcision. And I guess it depends on how tight they want to have the circumcision. So sort of on our sort of side, we like having a moderately tight circumcision, and ideally the scar to be as close to the glands as possible. And sometimes we see guys with these really loose circumcisions. I did a really big caliber last week. This guy had lots of skin in his circumcision, and so I got a text that night, sort of saying, "Oh, I've got quite a bit of swelling down there," and I discussed with him that he's likely to get that. And then I get a photo text to me on my phone. And so over the weekend, we're texting backwards and forwards, and I'm getting photos of this guy's penis sent to me, which is one of the weird things about this job. And then, gradually, of course, the swelling sort of went down. But yeah, that just sort of reminds us why a tighter circumcision is useful. Yes, I guess what we'll have to do is find somebody who does circumcision and get them.
Yeah, I think that would be a great idea, because I have actually had a couple of my clients have circumcision after having caliber, and there weren't any issues. However, I have had a couple of my clients visit doctors to talk about circumcision, and those doctors have been concerned about doing the procedure with filler in the penis already and how that might affect the outcome. But I have had a couple of guys, as I said, who have had circumcision with filler in the penis, and it's been a beautiful result. And yeah, you're right. Ideally, we don't too high and tight. It's going to take away some of that filler, and it's going to bring the filler further down, and the penis will taper in too early before getting to the glands or the head of the penis. So ideally, we want it tight, but not too high, and actually up towards the glands. But then the really loose, and I have encountered the really loose circumcisions, and the risk there is putting filler up the top there and creating almost a semi foreskin effect.
Yeah, it can be a bit stretching for guys who have had a circumcision but still have a moderate or excessive sort of amount of skin there, and you fill it up and stretch it out a bit.
Yeah.
Okay, well, let's see if we can grab one of those surgeons that have done the circumcisions on guys who've already had caliber, and we can see if we can get their opinion.
That's a great idea. Excellent. All right. Well, thanks for talking about the scrotoplasty. It's a really interesting topic. And hope that was really useful information for everybody out there who are looking into this or wondering, what that excess piece of skin is that may connect underneath the penis up towards the head and, may concern you and make your penis look shorter or create pain during sex. So there is a solution. It's Dr. Jason Oates in Perth at the moment. So thanks very much, Jace. Great to speak with you. And we'll speak again very soon.
Great. Talk to you then.